Hi everybody, welcome to week 5 in our advanced assessment course. I'm coming to you today from part of my front yard. Week 5, now we're over halfway. You guys are doing great. So this week we've got information about focus versus complete assessment. And we can think about this a little bit different. And different people can define these terms just a little differently. When I think about a complete assessment as an RN, I think about that beginning of the shift, head to toe in med surg or ICU, that inpatient kind of head to toe, or maybe I'm admitting a home health client and I'm doing a complete head to toe on that new patient. And so that's what I'm kind of thinking as when I'm thinking about a complete assessment. And then the focused assessment, I think about more with maybe a patient who comes into the ER and you're going to be initially focusing on their initial complaint. I think about when we've got to do Q1 hour neuro checks, something like that. Or we're doing a really good respiratory assessment throughout a shift on an asthma patient that we're trying to break hold of their lung constriction and wheezing, etc., and trying to determine their progress. And so I think of those as focused assessments. So we're going to talk in this week about the differences between them, the documentation components, things like that. One thing that was brought up in your lecture this week that I really do like is that old CARTS method, that acronym for assessing pain. I think sometimes too often we forget to ask about the aggravating and relieving factors. And really zero in on that pain experience. I actually had a thumb injury. Apparently, I've pulled a ligament in my thumb, and I went in to see my primary care provider because it's been going on for a month. And anyway, and I was very pleased that he did a nice exam of the joint, including range of motions, grasps. He compared both sides of the joints, either hand. And he did ask about aggravating and relieving factors. And I thought that was pretty cool. I don't think a lot of patients necessarily go to their doctor with thumb pain. But I thought he did a nice job in trying to determine what my problem was. So anyway, all right. So this week we're going to be working on a case study assignment. Now the assignment, it's just a little bit confusing, and I'm going to make sure everybody really understands it. So you've got that case study, and I love the case study. I really enjoy teaching about acid-base metabolism, figuring out blood gases, and anyway, it's one of my favorite topics to teach. So I was very excited when I saw the case study. One little thing, there's a whole bunch of different ways to do blood gases, but so many of my students get so confused with pH, and that the high pH is the alkaline and the low pH is the acid. So I do a little kind of dial type thing for them, and I say, okay, when the arrow goes all the way to the right, that's the high pH. You think of that as the milk side. And when it's low pH, you think of that as the Coca-Cola side. And 735 to 745, that's the golden window. And so I use those terms kind of throughout the teaching to help it bring it back into their mind a little bit practical. And anyway, I could talk about that for a long time, but obviously I really enjoy teaching that component. Okay, for the assignment, you've got the case study. You want to make sure that you follow the directions on the assignment, but that you also answer the questions at the bottom of the case study. It's just a little bit confusing. So it's going to be one paper combining both. And this will actually be presented as a paper. For instance, it talks about health history and physical assessment, and you'll be writing those out as paragraphs. And then you'll be answering the questions as paragraphs. So I didn't want there to be any confusion on this one. It is written like a regular paper, okay? And then the rubric does ask for references. So I think you need to back up things like how are you determining what type of blood gas, what condition that is. I think you need to back up those types of things with references. on this paper, I would suggest at least having 2 references that back up some thoughts in your paper to meet the condition of that rubric. If you have any questions about that, please shoot me a note in the individual or questions to the instructor forum. Like I said, it's just a little confusing because you have the directions and then you have the questions at the bottom of the case study. And I just want to make sure that you're really including both of those. All right, I think that's everything that I had in my notes for this week. I think I've got your group paper that I'm going to grade this weekend. And I hope you have a great week. Talk to you in the main forum.